Good evening. We are back in and welcome. We are going to hear some bills and we will hear them in order to start with, unless something exciting happens along the way. So we will start with Assembly Bill 102 and please come forward. Welcome. We're really not as crazy as we look, so.
Oh,
Or maybe we are. I don't know.
I've been in local government for a while.
Okay, good.
I recognize it.
Good. Please go ahead.
Thank you, Madam Chair, members of the committee. My name is Dave Cochran. I'm the president of the Nevada Fire Chiefs Association, and also in my day job, I'm the City of Reno Fire Chief. I'm here to present briefly on AB 102. AB 102 enables a county with a population of more than 100,000 or less than 700,000, so Washoe County, to regulate EMS on the local level. So that would be certifications, licensing, training for the EMS professionals in that county. It is an enabling legislation, so it would be up to the county to find the money, the staff, the processes, the procedures, all that. Two additional points. It does allow individuals starting at the age of 16 to engage in their internships, which is a part of the process to become an EMT. It doesn't change the requirements for EMTs, it just allows them to start the process sooner, because what we're seeing is twofold. They're offering these programs at the high school level, so you have younger people entering the programs, and it's actually a great recruitment tool selfishly for the fire department to get fire service, to get people engaged sooner. One thing the bill does not do, and I'll just end on this, is regulate trauma centers. That's very important to hospitals, so it's specifically called that. It was never intended to do that, but we specifically called it out in the bill so that it was clear that that was not part of what the bill encompassed. So with that, I'm available for any questions.
Can you give us a quick overview on the fiscal note?
Oh, absolutely. So the state did testify, and I'm not purporting to testify on their behalf. They did testify at Ways and Means, and they made it clear that the fiscal note will not impact staffing or otherwise negatively impact their service to the rest of the state. There is very much an intended consequence that doing this, because the state will maintain their staffing, will empower them and enable them to provide better service to the rural communities throughout the state, because Clark County has their own health district. If this were to come to pass in Washoe County, we would have our own. That would leave the state staff available to serve the rural communities at a higher level, we believe. And there was testimony to that effect at the Ways and Means Committee as well.
Okay, thank you very much. I think Senator Wynn has a question.
The way I'm reading the fiscal note on Nellis is it looks like it's a very, very small, if not like kind of unable to really determine whether or not how that revenue reduction might possibly be. Is that correct?
That is correct.
Okay.
Yes. And the state, again, confirmed that at the prior committee, the Ways and Means Committee.
Thank you. Any additional questions, Senator Titus?
Thank you, Madam Chair. Thank you for being here. I just have a quick question about the making eligible a 16-year-old, and I was wondering, again, this is a finance committee, just wondering about if that doesn't increase some liability on your part, or isn't there a cost there? Worried about that expansion down to that age, and is that kind of standard in other jurisdictions?
Please state your name for the record.
I'm sorry, Dave Cochran. I don't know that in other states, so this would apply to Nevada, so I can't speak to other states as far as the age limit. This would not increase the cost or liability, because the piece that it adds, or allows, I should say, is it allows the 16-year-olds to do their ride-alongs with an EMS provider, an ambulance, a fire department, something like that, who carries the insurance. We do that at the Reno Fire Department, where somebody comes on, we have insurance to cover that, and there is no cost. It's part of the program through their education.
Thank you. If I might, Madam Chair, I think it's a great idea because it's that pipeline of getting more paramedics, getting more firemen, getting that access, and engaging someone that early in a program is a very good idea. So thank you.
I 100% agree. One of our views of that is that there's a lot of people out there who would be great and would be qualified and would enjoy the program, but they just don't know how to get in. And if we can find more ways to get them in, it would be better.
Senator Taylor.
Thank you, Madam Chair, and thank you for being here, Chief. Thank you for bringing this forward. I just want to make sure, I want to make sure I understand the process in this. So we're really, what you're saying is just for our county, right, because we're the ones that fall within that piece, then our health district would be able to, the board would be able to vote as to whether or not they want to do this, to be able to put something together so we can, so that they can regulate, right, EMTs. Do I have that right, Chief?
You do. Dave Cochran. Yes, the board would have to establish procedures, processes, and would have to vote on those. They'd have to find the funding source. Like I said, it would be enabling legislation to allow them to bring that forward, but they would actually ultimately have to be the ones to decide to move that forward.
Thank you, Chief. Thank you, Chief.
Thank you. See how easy it is to switch those?
Chief and Chair, I got it. Chief and Chair.
All right. All right. With that, are there any other questions from the committee? All right. Thank you so much.
Thank you.
And if you'll step back, we'll go to those in support of Assembly Bill 102.
Good afternoon, Chair, members of the committee. Nick Ciccone, representing the city of Reno for the record. I did just want to go on the record to say that we do respectfully disagree with the state's fiscal note. As Chief Cochran had noted, this is enabling legislation. There's no guarantee that the Northern Nevada Public Health Board of Health would take on this responsibility in the next 2 years. That would be entirely up to them. Additionally, if we were to take on that responsibility, it would take on that workload as well. So thank you very much.
Thank you. Go ahead, please.
Good evening, Madam Chair, committee members. Todd Inglesby, representing the Professional Firefighters of Nevada. We wholeheartedly support this. We think allowing us to start recruiting at an early age, especially with our high school folks who are in these programs, and allowing them to gain experience and really understanding the job prior to really committing themselves is a great idea. We also have a similar model that I worked with in Southern Nevada, where the health district oversees all our EMTs, all our paramedic, all our licensing, testing, et cetera, and it works great. We think it would do a great benefit up here as well. Thank you.
Thank you very much. Go ahead.
Good evening, Chair. For the record, my name is Joelle Gutman-Dodson with Northern Nevada Public Health, and we are the local health authority for Washoe County, and we are in support of this bill. And like Nick Ciccone from City of Reno said, this is permissive language, and so we would have to, establish the program, find the funding, and create the program. And we really have to weigh whether that's feasible right now or not. But we like that we have the language so that we could have the ability to do it. And we also feel like this would possibly support the state so they can support the counties that don't have a health district, that aren't, won't be able to license and permit their own ambulances and EMTs. So we are in support of the bill. Thank you.
Thank you so much for being here. All right. Any additional support in Carson City, in Las Vegas, and on the phone lines? AVH, if you're ready.
Thank you, Chair. If you would like to testify in support of AB 102, please press star 9 to take your place in the queue. There are no callers wishing to testify in support at this time.
Thank you very much. Will anybody in opposition here in Carson City, in Las Vegas, and in the phone lines? AVH, when you're ready.
If you would like to testify in opposition to AB 102, please press star 9 to take your place in the queue. There are no callers wishing to provide opposition testimony at this time.
Thank you very much. And we'll go to neutral here in Carson City, in Las Vegas, and on the phone lines. AVH, when you're ready.
If you would like to testify in the neutral position for AB 102, please press star 9 to take your place in the queue. There are no callers wishing to provide neutral testimony at this time.
Thank you very much. Any closing comments? Okay, then we will close the hearing on Assembly Bill 102. Thank you for your time tonight, Chief, and we'll help you out with your people that are here. We'll keep an eye on them. Thank you very much. All right, with that, we will, I know we have several folk in the room, and so we're going to try to work down this. And so we'll start with AB 220. We're going to jump down there, and only Ms. Hunt, because you were here and waiting. So you get the first nod. I'm going to give you some. Thank you.
Thank you, Chair Dr. Loop and fellow members of the committee. My name is Linda Hunt, and I have the honor of representing Assembly District 17 in North Las Vegas. I'm here this afternoon, morning, to present today.
They all start blending together. You didn't know that, did you?
You guys told me, but now I see. I'm here to present AB 220. Okay, this bill authorized the Department of Health and Human Services to establish and administer a program for issuing identification cards to residents of this state who are experiencing homelessness. Access to ID is a fundamental necessity, yet many homeless individuals face significant barriers to obtaining IDs due to their inability to travel to the Department of Motor Vehicle offices. By allowing the department to issue IDs, where many are experiencing homelessness or are already seeking assistance, we can remove a major obstacle and ensure access to essential services, employment, opportunity, and housing program that requires a valid ID. The language of the bill is permissive, and fiscal notes from DMV and the Division of Welfare and Supportive Services are zero. So with that, I want to thank you, Chair Don Deraloup, and fellow members of the committee. And I also want to thank Deputy Administrator Kelly Cottrell from DWSS, Director Richard Whitley from DHHS, and Deputy Shannon Liss from DHHS, and Sean Severs from DMV. And I appreciate you guys, and I hope you consider this bill.
Thank
With
you.
that, I have any
Thank
questions.
you very much. All
Thank
right,
you.
any questions from the committee? I have a question. So when they go to do this, they're going to go out to the population rather than them coming to a DMV? Is that the way that will work?
Linda Hunt, for the record. No, Chair, what happens is they're going to place these kiosks in the welfare office. So when they're there, they can obtain the ID then.
Okay, thank you. All right, any other questions? All right, I don't see any. Hallelujah. Then, I know, hurry and run. All right, we'll go to those in support here in Carson City. Please start when you're ready.
Good evening, Chair and members of the committee. For the record, Carlos Hernandez, representing the Nevada State AFL-CIO. We are in full support of the bill. Thank you.
Good evening, Kayla Maese, Kaylahmaese, Civil Rights Analyst with the ACLU of Nevada, and we are also in full support of this bill. Thank you.
Good evening, Chair Daldera Loop, Joanna Jacob. On behalf of Clark County, we are in support of this bill as well. For many of the reasons that Assemblymember Hunt put on the record, we know that access to ID is a true barrier for those experiencing homelessness. Thank you very much.
Good afternoon, Madam Chair, members of the committee. Sarah Adler for the Nevada Opioid Treatment Association, and we agree ID is necessary to enroll in Medicaid to then be able to receive consistent treatment. So we in support. Thank you very much.
Chair, members of the committee, Jonathan Norman, NORMAN, Nevada Coalition of Legal Service Providers, we are in support. Thank you so much.
Chair, members of the committee, Paloma Guerrero, PALOMA, GUERRERO, on behalf of the Clark County Public Defender's Office, and we're in full support of the bill. Thank you.
Good afternoon, Ryan Vortish. That's RyanVortisch, Northern Nevada Democracy Coordinator with Silver State Voices, and we are in support. Thank you.
All right. Any other support here in Carson City, Las Vegas, and on the phone lines, AVH, if you're ready?
Thank you, Chair. If you would like to testify in support of AB 220, please press star 9 to take your place in the queue. There are no callers wishing to provide support testimony at this time.
Thank you very much. Anybody in opposition here in Carson City, in Las Vegas, and on the phone lines, please, when you're ready, AVH.
If you would like to testify in opposition to AB 220, please press star 9 to take your place in the queue. There are no callers wishing to provide opposition testimony at this time.
Thank you very much. And we'll go to neutral here in Carson City.
Hello, Chair, committee members. Sean Sever from the Nevada DMV. We are neutral on AB 220 and have a zero fiscal note on it, as mentioned. We have a program in place right now to give the unhoused ID at no charge. If the bill passes, we would work with DHHS through regulations to allow unhoused to bring IDs to the DMV and turn them into standard IDs, which mirrors a similar program we have with corrections. There will be, these will not be a real ID and won't allow for driving privileges, but they would be good for identification purposes.
Thank you very much. And Senator Titus has a question for you.
So thank you, Madam Chair, for the patience. There's no fiscal note on it. How can that be? Because there's a cost of, you charge other people to come in and get IDs, and it's not a real ID, so is it just doesn't cost as much to do a photo and they just give you the name that they go by at that moment? They don't need to bring anything else in. I'm just wondering about how this doesn't cost some money.
Sure. Sean Sever from the DMV.
I believe you have a phone a friend.
All right. Go ahead.
Shannon Litz, Deputy Director, Department of Health and Human Services. We have done a zero fiscal note because the language is permissive. We have the opportunity for grants and gifts and things like that. We'll continue to work with the DMV and can set that up as funding is available.
So under this program, then you would be able to offset any cost through the health department to help offset the cost of these IDs then? Is that what I'm hearing?
Shannon Litz, Department of Health and Human Services, for the record. We will continue to work with the DMV and make sure it aligns with their process, as you mentioned, the regulations, but also we know there will be setup costs, so we're really going to have to look at what that looks like. You'll see the original fiscal note did outline what some of that would look like for a setup, so we would, of course, pursue that if and when we're able to really implement.
All right, very good. Thank you. Thank you, Madam Chair.
And just to clarify, this is permissive language.
Shannon Litz, for the record, that's correct.
Thank you very much. All right. Anything else? Thank you very much, both of you, for being here. All right, then one in Las Vegas, and we'll go to the phone lines. AVH, neutral, when you're ready.
Thank you, Chair. If you would like to testify in the neutral position for AB 220, please press star 9 to take your place in the queue. There are no callers wishing to provide neutral testimony at this time.
Thank you very much. Assembly member, do you have any final comments? All righty. I think this is a good bill. Thank you very much, and thank you for being with us tonight. And with that, I'll close the hearing on Assembly Bill 220, and I'll open up the hearing on Assembly Bill 131.
Good afternoon, Chair and members of the committee. Jovan Jackson for the record. I'm very honored to present AB 131. with my co-presenters Mindy Elliott and Bill Brewer. AB 131 is a target measure designed to help address Nevada's affordable housing crisis by encouraging the development and utilization of accessory dwelling units or ADUs. So specifically, this bill provides an exemption from the property taxation for ADUs that are rented or leased to tenants receiving assistance through the Federal Housing Choice Voucher, also known as Section 8. This bill supports homeowners who open their doors to voucher recipients, helping to ensure that some of our most vulnerable populations and residents, families, seniors, veterans, people on disability have a safe, stable, and affordable housing. At the same time, it promotes the use of existing residential spaces in a way that we could relieve the pressure on the housing market without requiring costly new construction or major infrastructure changes. With that being said, I will pass the rest of my presentation off.
Thank you very much. Go ahead, please.
Thank you, Madam Chair. Bill Brewer. I'm the Executive Director for Nevada Rural Housing Authority. We are here to help present this bill. This is a limited approach to solving some of our housing problem. There's no silver bullet for housing. It's going to take death by 1,000 cuts to get this thing put into place, and this is just one of those cuts that we can do. There are some ADUs out there that could be utilized for housing. We struggle as a housing authority to find units oftentimes for our tenants, and so this would give them another option to be able to find units and would give the homeowner an opportunity to, or some motivation to rent to a voucher holder. This would be a small program. It's doubtful that it would be total more than 50 or 60 at best, I would think. But we have no idea until it's actually in place. If we're fortunate, it could be 50 or 60. That would be wonderful. There is a very small effect on the local government because of the property tax exemption, but again, that would be limited because of the number of units that are a part of that. Otherwise, there's really virtually no cost to the program.
Thank you very much. Go ahead.
Thank you, Madam Chair, and for members of the committee. For the record, I'm Mindy Elliott, MENDY-ELLIOTT, with Flynn Judici Government Affairs. And what is driving the fiscal note on this bill is Section 6. And it is a small tax exemption, and I want to make it clear, it's only for the ADU, it's only for the brick and mortars, it's not the land. The eligibility criteria is that the property has to be leased for 1 year, and needs to comply with local zoning laws. The housing authorities are responsible for actually looking at the piece of property, making sure that is in compliance with HUD, because HUD does have some strict requirements. We also moved the effective date of this bill out to July 1st, 2026. That gave the local governments time to ramp up, and for the local governments to work with the housing authorities to start identifying families or individuals that would qualify for the housing choice vouchers. The program was really, when we were discussing with the local jurisdictions, we envisioned that this would really serve for veterans and for seniors to rent these ADUs, and then they would be a blended family solution, and we could see them actually having dinners together. It's a pilot program, but as Mr. Brewer alluded, it truly is just one part of the solution. It's going to take a lot of solutions that we need right now for housing. So we really appreciate, first off, Mr. Jackson bringing this bill forward, but we want to say a big thank you to the local jurisdictions as we work through the various elements on making this actually a workable bill.
Thank you very much. Any additional comments? All right.
Jovan Jackson for the record. And just to clarify, like she said it, the tax exemption is not for the land, it's not for the primary residence, it's only for the ADU. And the housing authorities will be keeping track of how many ADUs are a part of this program. And I really do feel that this ADU program could build future revenue in the future when folks do decide to take their ADU off Section 8, and then we could start receiving those property taxes for those ADUs.
Thank you very much. All right, with that question, Senator Taylor.
Thank you, Madam Chair. And Assembly Member, thank you. Thank you for bringing this. This is, like I said, one of many solutions that we should be looking at to help. I just have a question. So these, and you said it's a pilot program. So is there a particular number that just start off with? I know you're delaying implementation for a year, but it's a pilot. So what? How does that? Does that mean then taxes kick in? Tell me a little bit about that.
No, thank you for the question. Through you, Madam Chair, to Senator Taylor. We're trying to see if this is going to work. In our discussions with the local, we looked at this program 2 years ago to see if it was worthwhile to implement, but through another bill. And at the time, we were really focused on the Home Means Nevada initiative, and we thought we couldn't bite off more than we could chew, so we felt that putting our emphasis in the Home Means Nevada initiative is where we wanted to focus our attention. So now that that's off and running and working, now this is the next opportunity for us to look at adding additional inventory by utilizing existing inventory. And we're hoping that there's a lot of interest. It's especially in the older parts of Reno that have the ADUs. But I do want to make sure that it's clear that they have to be HUD certified. So we want to make sure that when we're providing these vouchers, that the units meet the needs of those individuals. And I use the term pilot just since we've never done this before. We're hoping that it works very well.
Thank you so much. Thank you, Chair.
Thank you. Senator Neal, go ahead, please.
Thank you, Madam Chair. So this question is to Ms. Elliott. So with this pilot program, I guess the intersection of AB 396, Assemblywoman Backus's bill, what's the intersection here between the pilot that would be run here and then her bill, which is still on ADUs, but I mean, it seems to cross over into the HOAs, but there's also a provision in here that is not just HOAs specifically. It seemed to also touch like the broader county, but how do the two supplement each other?
Through you, Madam Chair, to Senator Neal, I'm not sure that Assemblymember Backus's bill is focused on housing choice vouchers. This bill is only limited to those housing choice vouchers that the housing authorities have available. And then they would work with their landlords to identify those that would want to rent their ADU utilizing the housing choice voucher. So it's very narrowly focused only on those housing choice vouchers. And then all of the rules and requirements that surround those housing choice vouchers, they have to have a year lease, they have to be HUD certified, they need to be inspected. The individuals have to qualify for the choice voucher. So I think that this bill is we're just narrowly focused only on that segment of the population. Hope that answers your question. I apologize if it doesn't.
It does, because basically the voucher that if a home fell into an HOA community, they would, and they were in the voucher program, they wouldn't even be included in this bill, AB 131, because they're two separate things, but they're ADUs, but this wouldn't apply, the voucher would not apply to a home that was in an HOA.
Bill Brewer, for the record. The voucher could apply to a home in an HOA, but that situation would have to meet all of the HOA rules that are in existence. It couldn't overrule any of the rules for the HOA.
where are these homes going to be? Are they anywhere, or is there, can you give me a little information on that?
Thank you for the question, Chair Daldera Loop. For the record, Mindy Elliott. They could be, I of course live in Reno, and the old southwest part of Reno, and I'm looking at Senator Taylor, and she's nodding, and there are many ADUs in that particular area. The ADU can be a standalone. It also could be part of the residence if they have we'll call it a mother-in-law quarter. So they could be anywhere, and since the legislature has taken some interest in ADUs in some previous legislation, we're hopeful that the utilization of the vouchers will be expanded because it does provide us another opportunity to. We think it's a quality program to blend families into the property. And as the program grows, we're hoping it grows, we get additional landlords, we serve families. And so for us, they could be anywhere. And in rural Nevada, there are a lot of ranches that might have a ADU that could be utilized for families out in the rural communities. So it could be anywhere.
And how will, what are the decision points on who gets a voucher?
Only my friend.
Bill Brewer, Nevada Rural Housing. Those vouchers are distributed based on a very fixed process by HUD. Recipients have to apply and be on a waiting list. They have to be chosen from the waiting list in random order based on the outline that we have with HUD. And then once they receive a voucher, we essentially say go forth and rent, find a place to rent. If we have places that we know about, we try to send those voucher recipients to the landlords where we know they can rent up. But it's a very limited number that go out every month and try to find a place to rent.
Okay, thank you. All right, additional questions, Senator Stone?
Thank you for the presentation. Is there any maximum number of accessory dwelling units per property that one can lease out?
Yes, there is. The maximum is 1.
Okay, we were just having questions. All right, thank you very much. Oh, sorry. Who's raising? Oh, Senator Titus, sorry.
Thank you. Sorry. So I just need a clearer understanding. I certainly understand that the mother-in-law quarter concept, and some older parts in Reno, I know that the little houses had garages, and when I was in college, I lived in a number of those type of places where they had the home, and then they rented out the garage or some little place on this, but it wasn't attached to the building. So, and I'm sorry if you clarified this, but the building has to be separate. It could be attached to the the main house, so to speak.
Thank you for the record. Thank you for the question. For the record, Mindy Elliott. I'm tired too. Is this morning? Through you, Madam Chair, to Senator Titus. It can be either or. It can be a standalone or it could be attached. But the abatement is only on the attached mother-in-law to that 800 square feet, or that detached 900,000 square foot standalone building, and it's only on the building, not on the land. And that's part of the responsibility. The Housing Authority will go out and actually do the inspection and work with the assessor's office to determine what that abatement is on that square footage.
Thank you for the clarification. I was wondering about that process where, so the Housing Authority goes out, they measure the square footage, they confirm that this is appropriate, and then they submit to the county assessor to take off X amount of square foot from the person's taxes.
Bill Brewer, for the record. That's basically correct. It's really up to the homeowner, though, to work with the assessor to get that tax abatement. The Housing Authority will only do the inspection to make sure the unit is habitable.
All right, very good. All right, thank you, Madam Chair.
Thank you very much. All right, any additional questions? All right, now I think we're in the clear. You can step back, and we'll go to those in support of Assembly Bill 131 here in Carson City.
Good afternoon, Chair, members of the committee. Nick Ciccone, representing the City of Reno. For the record, just wanted to go on the record in saying that we're in support. Initially, the bill had a negative fiscal impact to the city. The City of Reno is the only of the 5 large cities that does not currently allow for accessory dwelling units, so I could not reliably tell you how much that would cost us based on the abatements. I will say we're in the middle of the process of drafting that ordinance, and that would address some of the concerns related to attached versus detached, parking, etc. But thank you very much.
Wiz Rizard, W-I-Z-R-O-U-Z-A-R-D, Deputy State Director with American for Prosperity. And on behalf of American Prosperity Nevada, we urge you to support AB 131. This bill recognizes the growing importance of ADUs as a flexible and cost-effective solution to Nevada's housing challenges. By incentivizing homeowners to lease to voucher recipients, AB 131 promotes inclusive housing opportunities for low-income residents without resorting to heavy-handed mandates or large-scale government spending. Crucially, this policy aligns with AP Nevada's broader vision of reforming outdated housing, land use, and zoning regulations that limit supply, drive up costs, and make it harder for Nevadans to find and afford a place to live. Instead of creating new bureaucracies, AB 131 leverages the private market and empowers individual homeowners to be part of the solution, offering both a financial incentive and a social good. Furthermore, the bill includes clear guidelines and safeguards, including manual verification by public housing authorities and documentation requirements for county assessors. This transparency ensures that the exemption is applied fairly and only in cases where all qualifications are met. We greatly appreciate the bill sponsor, Mr. Assemblyman Jackson, for working diligently with stakeholders and ensuring that the bill was changed and amended to work in a way that Nevadans can truly see the direct benefits. So we urge this committee body to vote in support of this bill. Thank you.
Thank you very much. Any additional support here in Carson City? In Las Vegas? On the phone lines, please. AVH, when you're ready.
If you would like to testify in support of AB 131, please press star 9 to take your place in the queue.
Hello, my name is Jerry Williams Conrad with the Reno Housing Authority, JERRIWILLIAMSCONRAD. Thank you, Chair and members of the Committee on Senate Finance. The Reno Housing Authority is in support of AB 131. We want to thank you, all the bill sponsor, for all the hard work, and thank this committee for hearing the bill. Thank you.
Thank you very much. Next caller, please, AVH, when you're ready.
If you have recently joined us and would like to provide testimony in support of AB 131, please press star 9 to take your place in the queue. There are no further callers wishing to provide support testimony at this time.
Thank you very much. Those in opposition here in Carson City, in Las Vegas, and on the phone lines, please, AVH, when you're ready.
If you would like to testify in opposition to AB 131, please press star 9 to take your place in the queue. Caller with the last 3 digits, 849, please press star 6 to unmute yourself, and you may begin. Once more, Caller with the last three digits 849, please press star 6 to unmute yourself, and you may begin. Chair, the caller seems to be having difficulties. Would you like to move on?
Yes, please. Are there any callers in neutral?
If you would like to testify in the neutral position for AB 131, please press star 9 to take your place in the queue. There are no callers wishing to provide neutral testimony at this time.
Thank you very much. Then we'll come back here to Carson City. Anyone in neutral? And anyone in Las Vegas? All right. Any closing remarks, Assembly Member? Okay. With that, then we'll close the hearing on Assembly Bill 131. Thank you very much. And we'll go back to Assembly Bill 336.
Good evening, Homa Sayar for the record, H-O-M-A, last name S-A-Y-Y-A-R. Most recently, General Counsel of the Nevada State Purchasing Division of the Department of Administration, now Deputy Director for the Department of Indigent Defense Services. Assemblymember Brown May graciously allowed me to continue to present this bill that came out of the interim senior citizen the Committee on Senior Citizens, Veterans, and Adults with Special Needs. It relates to the veteran preference. There was a law passed that gave a 5% preference for veterans with service-connected disabilities when they are proposing on state government contracts. The following session, the Nevada state preference was introduced, which allowed any Nevada-based business to have a 5% preference. Those preferences do not stack. So that means that our veterans with service-connected disabilities don't necessarily get any advantage over any other Nevadan, which I don't believe was the intention of the original legislation. So this bill seeks to correct that. It also seeks to address the inverse preference, which punishes Nevada businesses when they propose on government contracts out of state, where it's kind of an arms race for states to count preferences against each other. And a lot of states have laws that say, if you have an inverse preference, then we have one against you. And so our GDP is such that it benefits Nevada businesses to do business elsewhere as well. And so the removing that inverse preference would help them expand their businesses. And there's a $0 fiscal note as well, but I'm ready for any questions.
Thank you so much, and thank you for being here. Questions from the committee? Senator Taylor.
Thank you, Madam Chair, and thank you for being here, and thank you for, I didn't know the program existed, so that's fantastic. So I just want to make sure I get it. So when veteran organizations, or companies, whatever, when they bid on the state contract, they get the 5% preference. Yes, and then I know Nevada businesses get the 5% preference. Is a part of the bill that you want them to stack? Because I know right now they don't stack, right? Am I correct?
Thank you for the question. Homa Sayar for the record. Through the chair to you, Senator Taylor. Yes, currently they do not stack. There's language in the law that says that you get one or the other, but they pretty much are this. You know, most people, we don't even have data really on the veteran preference because it's easier than going through a process of certifying as a service-connected, disabled veteran. It's easier to just say, I'm a Nevadan, and you get the preference. Mm-hmm. And so for services contracts, obviously those aren't just price. We do best value, so that would give them a 5% boost. Now with the bill would give them a 10% boost on their score. Nevada business that's toe-to-toe with them would only get a 5% boost to their score, and an out-of-state business would just be scored as they normally would.
Thank you very much. Senator Neal, did you have a question? All right. Any other questions from the committee? All right, you may step back. Thank you very much. Those in support here in Carson City, Las Vegas, and on the phone lines at AVH when you're ready.
If you would like to testify in support of AB 336, please press star 9 to take your place in the queue. There are no callers wishing to provide support testimony at this time.
Thank you very much. Opposition here in Carson City, Las Vegas, and on the phone lines, AVH when you're ready.
If you would like to testify in opposition to AB 336, please press star 9 to take your place in the queue. There are no callers wishing to provide opposition testimony at this time.
Thank you very much. And those in neutral here in Carson City, in Las Vegas, and on the phone lines, AVH, when you're ready.
If you would like to testify in the neutral position for AB 336, please press star 9 to take your place in the queue. There are no callers wishing to provide neutral testimony at this time.
Thank you very much. Any closing comments? All right, with that, thank you very much for being here. We'll close the hearing on Assembly Bill 336, and we will go to Assembly Bill 212.
Thank you, Madam Chair. Members of the committee, for the record, Leslie Pittman here today on behalf of the Waterford Institute. Really very much appreciate this opportunity to appear before you this evening. Chair Dondero Loop, I was just going to go briefly through the changes in the bill, if that's okay, and then just talk a little bit about what's transpired over the course of the interim on this program, since you all have leave behinds that I shared with you about how the program works, and it's a late hour. So AB 212 actually renames the program of the Virtual Early Childhood Family Engagement Pilot Program, removes the word pilot from the program, and that was a program that was passed by the legislature in the 2013 session via AB 348. Section 4 has some new reporting dates, extends the program out 2 more years. And then Section 5 includes the new appropriation request of $2 million for throughout the biennium, $1 million for each year. So, as I said, I represent the Waterford Institute, and in May of 2024, the Institute was awarded the state contract by the Nevada State Board of Examiners to conduct the Nevada Virtual Early Childhood Pilot Project through its Upstart program. Waterford immediately hired a professional recruiter who began working with various community-based organizations throughout the state to find families who met the pilot project's eligibility criteria. And by June 30th and the conclusion of the first fiscal year of the program, 395 children were registered. A report required by AB 348 and prepared by the Nevada Division of Welfare and Supportive Services, who administers the program, was submitted to the legislature at the end of the first fiscal year and includes information on the demographics of those children enrolled in the program. Today, there are 1,170 children registered in the program. 994 children have received laptops, and 474 households have received internet service. Because we are nearly through the program, which corresponds with a normal school year, we will have program results on this cohort of participants early this summer for you. However, submitted as an exhibit for the committee's consideration is a combined cohort analysis of the learning gains achieved by 3,000 Nevada children who have participated in Upstart from 2020 to 2024 through a variety of funding mechanisms, including privately funded pilot projects targeted towards Southern Nevada Latino families, Clark County recovery funds that were granted for programs for rural families, and ARP ESSER evidence-based summer enrichment and after-school programs awarded in partnership with the Charter School Association. You will find significant learning gains in this combined cohort analysis, with the majority of participating children testing at kindergarten, intermediate, or advanced at the conclusion of the program, and in several vocabulary areas, participating children tested at first grade levels once they concluded the program. So as you continue your work to help increase the number of Nevada children participating in early childhood education, we ask that you continue to support innovative programs like this that allows for the mixed delivery of early childhood education to meet the needs of Nevada families for whom a host of reasons are unable or unwilling to access site-based pre-K early learning programs for their children. Thank you.
Thank you very much. I believe we have some questions, and we'll start with Senator Nguyen.
I have a couple of questions. You had referenced an amendment. Was it amended on the other side, or is there another amendment that you're proposing today?
Thank you for the question, Senator Nguyen, through you, Chair Dondero Loop. That was on the Assembly side. I'm sorry.
got nervous there for a second. It was blinking. I guess I have a couple of questions. I know that you have been doing this for now 2 years since the last legislative session. Is that correct here in Nevada?
For the record, Leslie Pittman, we were awarded the contract in May of 2024. So it was a late RFP issuance by the purchasing division.
And you were issued that RFP. How much was that RFP, and what were those funds from? Like, who were they distributed from?
So it was $2 million that was awarded or appropriated in AB 348 from the 2023 legislative session.
And so that was a specific appropriation to Waterford Upstart in that bill, or was it to other companies that are similarly situated?
Thank you for the question, Senator Wynn. Leslie Pittman for the record. No, it was required an RFP process, which we participated in. In full disclosure, I will share with you, we were the only ones who responded to the RFP. But yeah, it was a competitive process, and again, we were awarded the contract by the Board of Examiners in May of 2024, so we scrambled quickly because the program starts in September to recruit as many families as we could. And we also knew that there was a September reporting deadline in AB 348 to the legislature.
And that $2 million that you received during that RFP process, how many students does that cover, and when does that funding run out, or has it already run out?
It's already been earmarked.
Okay.
Leslie Pittman for the record, sorry. 1,174 families are enrolled in the program. So the cost of the program is really, it's $1,100 for the curriculum, software, and the coaches, and roughly $1,000 if a family needs internet service and a laptop. So when we try and plan out, what this next $2 million appropriation, what that might accommodate in terms of families, it all really depends on how many households need internet service or laptops, because that obviously costs a little bit more money than just the curriculum software and the coach.
Chair, do you mind if I ask a couple more questions? I'm just curious on what criteria you use to determine who is eligible for, I guess, this program. And I'm assuming if you are targeting children in this early childhood space, they might all need internet and devices. Is that what you're finding to be true?
Leslie Pittman for the record, Senator Wynn. Yes, there's, so I said we had 1,174 families enrolled in the program, and I believe 970 of those families needed so hold on, 994 children received laptops, and 474 of those households needed internet service. And the eligibility, to answer that question, is laid out in Assembly Bill 348. So to be eligible for this program, a family has to live in a rural area, has to be a foster family, part of a foster family, or has to be meet a certain income threshold.
Thank you. Thank you, Chair, for the indulgence in all the questions.
Senator Neal.
Thanks, Madam Chair. So, in the bill, there's a list of demographics in Section 4. So are some of these low-income families that are in the rural communities?
Thank you for the question. Through you, Chair Dondero, loop to Senator Neal. Yes.
So does this program take advantage of, the Cox program for low-income families where it allows them to get a certain amount of internet for a reduced cost and sometimes free?
Leslie Pittman for the record, I don't know. I can certainly get that answer for you from my client who was unable to be part of this conversation this evening.
Okay, that would definitely, I'm just curious about that. I'm just wondering if any of the program costs are subsidized through what, one of the major vendors for internet offers in the state.
Okay. I'm happy to look into that and get back to you on that.
Thank you very much. And I'm going to follow up on that. I was going to ask, do they apply for grants, federal funding, any other, do they work through United Way? Do they, what other sources of funding do they have?
Leslie Pittman for the record. So Waterford Upstart, to the best of my knowledge, uses a number of, they receive private foundation funds for programs where they go into states and conduct their own privately funded, foundation-funded pilot programs, because they use kind of a proof of concept when they enter into a particular jurisdiction, and that is they use private funds to do pilot projects and then utilize the results of those to demonstrate to public policymakers the value of their program and the effectiveness of their program. And so that's what they've done in Nevada since 2019. They do work with Head Start in other states. They work, but I can get more information on that list of the grant programs that they work with as well.
Thank you very much. Senator Nguyen, did you have another question?
I do. Thank you for the second bite at the apple. Sorry, I'm looking at this. Obviously, I was getting a little distracted because I know that you are here on behalf of Waterford Upstart. So this isn't an allocation to your business. This is going through that same pilot program that's being renamed. Is that my understanding?
Leslie Pittman, for the record, yes, we would have to go through an RFP process if this program is renewed, because our award of that contract was just for that pilot program.
Are there other companies and other organizations, either nonprofits, other educational, like either for-profits or nonprofits, that work in this space in other areas, in other states, and other jurisdictions where your company operates?
For the record, Leslie Pittman, yes. This bill specifically indicates that the state cannot contract with a for-profit entity for this program.
Okay. Thank you.
Okay, thank you very much. All right, any additional questions? Senator Taylor? Senator Titus? All right. Thank you very much. All right. Anyone in support here in Carson City, in Las Vegas, on the phone lines, AVH, when you're ready.
Thank you, Chair. If you would like to testify in support of AB 212, please press star 9 to take your place in the queue. There are no callers wishing to provide support testimony at this time.
Thank you very much. Anyone in opposition here in Carson City, in Las Vegas, and on the phone lines, please.
If you would like to testify in opposition to AB 212, please press star 9 to take your place in the queue. There are no callers wishing to provide opposition testimony at this time.
Thank you very much. And with that, we'll go to neutral here in Carson City, in Las Vegas, and on the phone lines, please.
If you would like to testify in the neutral position for AB 212, please press star 9 to take your place in the queue. There are no callers wishing to provide neutral testimony at this time.
Thank you very much. Any closing comments, Ms. Pittman? Okay, thank you. Thank you for being here this evening. And with that, we'll close the hearing on Assembly Bill 212, and we will open the hearing on Assembly Bill 259. Good evening, and please go ahead.
Good evening. Thank you, Chair Dondero Loop and members of the committee. I am Venetia Constantine, and I have the honor of representing Assembly District 18. I want to thank you for the opportunity to present Assembly Bill number 259 to this committee. AB 259 is about taking an opportunity to provide relief to those Nevadans who are dealing with significant health issues. The bill is designed to reduce the cost of certain high-cost non-competitive, life-changing drugs by extending the benefits of federally negotiated Medicare drug prices under the Inflation Reduction Act to Nevadans who are not on Medicare but need these specific life-sustaining drugs. I brought this bill in 2003, it was AB 250 then, and there were no fiscal notes. However, it was vetoed. This session, there is one fiscal note with a monetary amount from PEB. I reached out to PEB and asked about the fiscal note. The response said that the fiscal note came from Express Scripts, which is PEB's pharmacy benefits manager. Express Scripts determined that it would be a net cost increase because they, who are both the PBM and also a pharmacy, wouldn't be getting the manufacturer's rebates. It is unclear how to respond to this when Express Scripts is both the pharmacy benefit manager and a pharmacy and is part of the vertically integrated system that AB 259 seeks to cut through. To be clear, the idea behind this bill is that there is a negotiated price that is negotiated between the manufacturer and the federal government, and that is the maximum fair price of the drug, along with a pharmacy fee that could be charged to a Nevadan for the drug. So having the fiscal note state that the reason that there is a fiscal note is because the PBM won't get the rebates if they utilize the maximum fair negotiated price of a very limited number of drugs for a limited number of people who are in real need of life-sustaining drugs is problematic because the intent of AB 259 is that the negotiated price is the price that is intended to bypass the pharmacy benefit manager kickback program. And this sort of shows how difficult it is to navigate the opaque nature of this system. But I brought this bill for a second time because it's about people. I believe that if a 66-year-old with blood cancer has the ability to afford life-sustaining drugs because of a negotiated price, the family of a 14-year-old fighting the same blood cancer shouldn't have to result in that child's family going through economic ruin, be forced to decide between rent, food, or the life of their family member because they have to pay an astronomical price for some of these prescription drugs. This is a way to provide health care to Nevadans based on something that has already been federally negotiated. And I'm happy to answer any questions.
Thank you very much. All right, questions? Senator Taylor.
Thank you, Madam Chair, and good to see you, Assembly Member. Thank you for being here. So I want to just restate this because it's late and I'm tired and I want to make sure I don't miss it. Okay, so basically please correct me if I'm wrong, this is really, the intention is to mirror the prescription discounts that are occurring at the national level that come through Medicaid, or I think I'm mixing it up with the bill that was last session.
Thank you for the question, Senator Taylor. Venetia Constein for the record. So it's the same bill as last session. What it's meant to do is to mirror under the IRA that allowed Medicare to directly negotiate with the manufacturer, with the pharmaceutical manufacturers. So otherwise you have Medicare Part D that does have, works with PBMs and does all of that. This was separate from that for very specific, high-cost, non-competitive drugs for some of the highest needs and the highest costs. So there is no other way to find a drug because that's not out on the market for it. And because they created that, when I was here 2 years ago, those drugs hadn't been selected yet. So now they're selecting those drugs. And since those drugs have been selected and there is a negotiated price, the idea to try to break through this sort of vertically integrated system that is sort of built on this very opaque what goes here, what goes there, move all the stuff, is to just take that and bring it to Nevada for those same drugs, for that subset of people who are not on Medicare to have a more affordable way to get the drug. And that's what it's sort of based on. Does that answer your question?
It does, Assembly Member. Thank you very much. Thank you, Chair.
Thank you very much for that question because that was a good, thank you for the clarification. All right, any additional questions from anyone? Senator Stone.
Thank you for your presentation. How does the state force these drug companies to honor the same price that they've negotiated with Medicare and the federal government, for that matter, that has really jurisdiction over pharmaceuticals?
Thank you for the question, Senator Stone. Venetia Constein for the record. Well, the idea when we tried to start this 2 years ago was to give us time to try to work all that out before the drugs were selected. But it is something that will need to be determined, but I don't think it's impossible. I think there's a movement right now across the country to sort of break through the current system that is there. And if this works at one level and manufacturers are willing to negotiate on that, I'm hopefully thinking that this will not only begin a new process, but it will allow Nevada to focus on what we are supposed to focus on, is the people in Nevada, the health of the people in Nevada, the safety of the people in Nevada, and the ability to pay for your shelter, everything that you need to pay for, and not be in a situation where because of a lack of willingness to some of the biggest companies in this country, that there are people that are not able to afford their life-saving drugs. So I don't think it's impossible to work this out, but I think we need to begin a process to do it.
So if I can follow up, so you see this as a negotiation process, not as a hammer?
Thank you for the question, Senator Stone. Venetia Constein for the record. So I want to be clear that the negotiated prices between the federal government and Medicare, that is not what I'm talking. I'm talking about the negotiation on how to make this work in Nevada is the things that are more open to fungibility.
Thank you.
Thank you very much. Would you speak to the fiscal note?
Yes. Thank you for the question, Senator Dundara Loop, Venetia Constein for the record. And I'm sorry if I went over that a little bit fast, but the fiscal note is the 1.8 million. And that fiscal note, I asked how that came about, and it came about because Express Scripts responded to PEB, and their response was that with no additional savings from manufacturers' rebates to reduce costs, they would need to increase monthly per member charges by $1.50 per member per month, and that includes both the primary and dependents, and that would be for 51,168,000 people. So that would, and I'm sorry, this is a letter that I received from PEB. I don't believe you have this.
I do see PEB in the audience, so perhaps they want to come up and make a comment. Thank you.
So this is Celestina Glover, CELESTENA V as in Victor, ER. I am the Executive Officer for the Public Employees Benefits Program. So just a piece of clarification. The rebate we're talking about, it's not the PBM getting the rebate. They're getting it, but they're passing it through to PEB. That is a revenue stream for us. Based on what they're telling us, they compared the MFP to our current ingredient costs using the 2024 costs that they had available. Their calculation is an additional $1.50 per member per month. That is for covered lives, the 51,000 that the Assembly member was talking about. And that works out for plan year 27, which is fiscal year 27, $921,000. And then 1.8 million in future biennia. So that is based on the 10 drugs that we're aware of right now. If that drug list increases, that cost potentially increases. We don't know that for sure. We also don't know which drugs on the list the manufacturers may determine are ineligible for those reserve or for those rebates. So that is our concern, is that we use that as a revenue stream to keep our premiums down for our members and the employer contributions down, and it's fairly significant each year.
Venetia Constein for the record, and that is correct, and that is also the question that I had about the fiscal note, because this is exactly what Medicare was dealing with, was this whole system of relying on rebates and for all of this, which is the IRA tried to break by creating this system where you have the manufacturer dealing directly with Medicare to have that, so that happens outside of the system.
Thank you very much. Senator Nguyen, did you have a question?
I do have a question. And this might be for either a Medicaid. I see Administrator Weeks here, and I also see Keiko over here, so she might be able to come up and ask if you're not able to, Assembly Member. I know that as a part of like our budget closing and even a lot of the programming that we're choosing to fund right now are coming from a lot of these pharmacy rebates that I go back to the state that you kind of alluded to. And I just think I had a different understanding than what you just represented in here. And so I'm wondering if I could get some clarification. I don't know. I'm just curious. I know that you have an undetermined fiscal note, but it seems like it might be potentially a very large number, an undetermined large number. But I do also know that we incorporate a lot of that into our state funding, not just through like PEB, but other things. So is there can someone kind of address that maybe?
Keiko Duncan, Division of Healthcare Finance and Policy, Chair, Committee members. Yes, so the division has determined that there would be a fiscal impact, that it would potentially be quite significant, potentially in the millions, but again, indeterminable. And that is dependent upon access to these particular medications at these particular prices. Dependent upon that access, it could create a shift in the compliance to our preferred drug list, which would then create a shift in the amounts of supplemental drug rebates and federal drug rebates that we would receive. That is dependent upon our utilization. And, of course, those rebates also contribute to the general fund as well.
I mean, obviously, I'm sort of familiar with some of these rebate pass-throughs and how they work. And part of the reason, like in other pieces of legislation, we don't see the state or PEB or other nonprofit or organizations like health trusts and stuff like included in that is because there isn't that same profit structure to be able to, that. Well, we hope when it comes to the state, we're good stewards of the money and we're making sure that we're reinvesting that and lowering down healthcare costs. So when you say millions of dollars, I know that there are several programs that we have put through these money committees that were in the $50 million range, including the majority leader's bill that were from some of these pharmacy rebates. So when you say undetermined, are there any protections that we can put in place to make sure that things that our budget is currently based on would not be affected by any of the pieces of legislation? And that might be to the bill sponsor, or I'm not sure who can answer that.
Chair, Committee members, Dr. Duncan for the record. I would say that would be difficult to determine simply because of the aforementioned negotiation process that would have to take into place. And so we would not know how that negotiation process would affect the negotiation process for our supplemental drug rebate contracts.
Venetia Consulting for the record. And this is the paradox that we face in this situation is because on the one hand, we want to get prescription pharmaceutical drugs to people who are truly in need, because I think it's our responsibility, for the state and for everyone in the state. But the current structure of the system is incredibly difficult to change because it is embedded in so many different ways that we sort of rely on this sort of circular system to do it. So one of the reasons that I brought this bill is because in talking to folks on how to try to resolve this issue, it was very much always, well, it's not us, it's them. There's all these issues. You're not going to be able to do this anymore because we need it for this, because we depend on this. And it was frustrating because the bottom line, somehow I want to get to the point where we're like, this is a person who is very sick and needs drugs, and how do we get it to them in a situation where they are not going to have to put their house up for sale in order to pay for something? And this is the main paradox of I think, our total healthcare system right now.
Thank you. I appreciate that. I think we all have that same kind of intent where we're trying to lower prescription drug costs. And I think it does take a holistic, approach. I have a hard time taking off the budget hat because I know that whether rightly or wrongly, I think it's like in the $400 million range that we're talking about with some of these like rebates. And I know that we have some bills that we passed out, including one from Senator Scheibel around creating a single PBM for Medicaid. And obviously that would impact that bill. Your bill would impact that bill too. So I'm just trying to think out loud if there are ways to kind of incorporate some of those things together. But thank you. Thank you for the conversation.
Thank you very much. Ms. Glover, could you get us the letter that you referenced? And you can send it to Mr. Thorley.
Yes, I can do that.
Thank you. All right. Any additional questions from the committee? All right. Seeing none, step back, and we'll go to those in support of Assembly Bill 259. And here in Carson City, in Las Vegas, and on the phone lines, please, AVH, when you're.
If you would like to testify in support of AB 259, please press star 9 to take your place in the queue. There are no callers wishing to provide support testimony at this time.
Thank you very much. We'll go to opposition here in Carson City, in Las Vegas, and on the phone lines, please, AVH, when you're ready.
If you would like to testify in opposition to AB 259, please press star 9 to take your place in the queue. Caller with the last 3 digits 903, please press star 6 to unmute yourself, and you may begin. Once more, caller with the last 3 digits 903, please press star 6 to unmute yourself, and you may begin.
Dear Madam Chair, Dondero Loop, and members of the committee, for the record, my name is Primo Castro, State Government Affairs Director with the Biotechnology Innovation Organization. BIO is the largest trade group representing more than 1,100 biotech companies, academic institutions, state biotech centers, and related organizations across the United States and 31 other nations that are involved in the research and development of healthcare, agricultural, industrial, and environmental biotech products. BIO opposes AB 259, which would set caps on the price paid for prescription drugs in Nevada based on the maximum fair price as determined pursuant to the Inflation Reduction Act of 2022. This bill's imposition of a maximum fair price would not have the effect the proponents of this bill intend and would instead risk access to medicines that many patients depend on. Many pharmacies and hospitals purchase medicines through national or regional buying groups or national contracts based on national pricing indexes in transactions that occur out of state. As a result, those transactions would not be subject to the price limits in the bill, but the price in state providers charge patients would be subject to the limits. Out-of-pocket costs have been rising for patients because of decisions made by health insurers. In fact, insurers require patients to pay almost 5 times more out of pocket for prescription drugs than for hospital care. These proposed price controls disregard and may even interfere with the market-based ecosystem of the U.S. healthcare sector. The maximum fair price approach does not provide adequate context for the complex issue of pricing, which is based not just on manufacturers' costs, but also on market forces and an assessment of value that cannot simply be reduced to a line, on the balance sheet. Thank you.
Thank you very much. Anyone else in opposition?
Good evening, Chair and members of the committee. My name is Kyle Piccola, Piccola, and I am a Director of State Policy for Pharmaceutical Research and Manufacturers of America. I am respectfully here in opposition to AB 259. We can absolutely agree that affordable access to prescription drugs is critically important for Nevadans, but we disagree that this bill will accomplish that goal. I will focus my remarks on the fiscal impacts of the bill. This bill oversimplifies an extremely complicated federal policy and fails to recognize that it will cost money to implement in the state of Nevada. As was discussed today, the Public Employees Benefits Program estimated that it could be almost $1 million during 2026-2027 and $1.8 million during future biennia. The Department of Health and Human Services Healthcare Financing and Policy stated that while the fiscal impact for this bill is indeterminable, it could be significant. I would like to point out that there are many drugs that are still not identified for the IRA, which means that there could be even additional fiscal implications for these programs. By 2030, up to 80 drugs can be impacted. It will also take significant resources for Nevada to pass and implement the provisions of AB 259. Nevada will have to create a brand new infrastructure like they did at the federal level. A recent study from the Pacific Research Institute found specifically in Nevada that this could cost Nevada $2.3 million annually to implement, and that doesn't include the technology investments that this may need. There's also a loss for patients. According to a January 2025 report from the National Community Pharmacists Association, a majority of independent pharmacists are considering not stocking one or more of the first 10 drugs listed on the Medicare Drug Price Negotiation Program. 32.8% of these pharmacists have already decided not to stock one or more of these drugs, and another 60% are considering not stocking one or more of these drugs. And lastly, the federal government has had to provide significant and additional resources since the passage of the IRA and its MFP policies. The Biden administration created the Premium Stabilization Demonstration Project. This pilot allocated an additional $5 billion to dampen the cost of the MFP and prevent Medicare premiums from going up. For all of these reasons, we ask that you vote no on AB 259 and ask that you look at proven policies that can reduce prescription drug costs for Nevadans. Thank you.
Any additional callers, ABH?
There are no further callers to provide opposition testimony at this time.
Thank you very much. Anyone in neutral here in Carson City, in Las Vegas, and on the phone lines, please, ABH, when you're ready.
If you would like to testify in the neutral position for AB 259, please press star 9 to take your place in the queue. There are no callers wishing to provide neutral testimony at this time.
Thank you very much. Any closing comments, Assembly Member? Okay, thank you very much. All right, with that, we will close the hearing on Assembly Bill 259, and we'll go to Assembly Bill 479, and we'll welcome Assembly Member Watts.
Thank you. Good evening, Chair, members of the committee. For the record, Howard Watts, representing Assembly District 15. I'm glad to present Assembly Bill 479 for your consideration today. Essentially, what this bill looks to do is ensure that our agricultural property owners have the ability to install solar on their land and continue to receive the property tax treatment that agricultural property enjoys. You will see within the bill the words agrivoltaic purposes. That is essentially using the same piece of land both for agricultural production and solar energy development. In order to get certain property tax treatment, agricultural land has to remain in agricultural use. There was concern that if we added solar energy production onto that land, that could jeopardize that tax status. So this is meant to help encourage that and encourage the maximum use of land where possible to get the most out of it. We made some additional adjustments to ensure that this is not something that could be used on non-agricultural property to try and obtain the agricultural property tax treatment. And additionally, this can actually have the potential to increase property tax revenue because the value would have to be reassessed to account for the additional value of the solar power production. So that is what the bill does. I'm glad to answer any questions that the committee may have.
Thank you very much. And would you just address the fiscal note, please?
Yes, Howard Watts for the record. So there was a fiscal note on the original bill. The amendment that we made that's reflected in this first reprint addressed all of the fiscal notes that and concerns, both from the state and local entities.
All right. Any questions? Senator Titus.
Thank you, Madam Chair. And the reason there's no fiscal note is because this property would have already been at that lower taxation rate. And what this bill does is just maintains the status quo.
Howard Watts for the record. Yes, that is correct, Senator. And you can actually see on page 3, line 21, it explicitly requires that land has to be receiving that tax status currently, so as of July 1st, but essentially now, in order to receive this benefit.
A follow-up, Madam Chair. As you know, you've been out to rural Nevada and you understand the water, especially in central Nevada. A lot of fields go fallow when there's lack of water. So the fields are just sitting there not producing and there's no water for the fields. But perhaps they're getting that tax exemption. So this would allow the farmers to actually have some production on there and kind of a win-win for renewable energy and continue to maintain the ag discounts.
Howard Watts for the record. Yes, that's correct. So the goal is to really help bolster our rural and agricultural communities by providing, one, something that could help address their energy needs on their land, to help bring in revenue, right? Whether it's leasing with the company or some other arrangement that brings in additional income for that landowner. Also, you may hear from folks with Eureka County. This is something that they've been looking at, including in Diamond Valley, as something that can be incorporated, right, with retiring some of the water-intensive alfalfa hay production, maybe moving to a lower water use crop, and also helping get some of our water-stressed basins back into balance. But I just want to note, this is not conversion, so this ensures that we maintain the agricultural character of these lands and the communities.
Thank you, Madam Chair.
Thank you very much. Any additional questions from the committee? All right, seeing none, step back. Thank you very much. Those in support of Assembly Bill 479, please go ahead when you're ready.
Thank you, Chair and members of the committee. My name is Olivia Tanager on behalf of the Sierra Club Toyabe chapter. For the record, as you just heard Assemblymember Watts say, this is truly a win-win for revenue for our state, for our agricultural communities, for renewable energy development, for water conservation. Really a lot of bonuses here, and we've been working with a broad coalition of stakeholders on this measure, making sure that we are taking everything into account. So this is a bill that we proposed in the interim, and we're really excited that it's gotten to this point. Again, we've been working with Department of Ag and a whole number of folks on this, so we encourage your support on this measure. Thank you.
Hello, Chair Dondero Loop and members of the committee. My name is Jane Amone, and I am the Nevada External Affairs Director for the Nature Conservancy. And we want to thank Assemblyman Watts for bringing this bill forward and the other bill proponents. The Nature Conservancy supports transitioning to renewable energy sources with a smart from the start approach that develops energy projects while maximizing conservation values and promoting economic development and stability in Nevada. Using already disturbed lands for renewable energy development conserves these lands for wildlife. It helps with tribal cultural values and recreational opportunities while preserving the socioeconomic structure of communities. And this may also help address our declining groundwater levels. So we urge your support for AB 479. Thank you so much.
Good evening. For the record, my name is Vincent Guthrow. Last name is spelled G-U-T-H-R-E-A-U. I serve as the Executive Director of the Nevada Association of Counties, or NACO. We represent all 17 counties. AB 479 in its first reprint, it is satisfied the fiscal note issue for us at the local level, and we can move to support. We want to thank, I'm just going to take a moment to thank the proponents of this measure for reaching out to us very early on and engaging us on this and working to this solution. So thank you for bringing that. We urge support. Thank you.
Thank you very much. All right, support in Las Vegas and on the phone lines, AVH, when you're ready.
If you would like to testify in support of AB 479, please press star 9 to take your place in the queue.
Cage. Good evening, Chair and members of the committee. This is Caleb Cage, C-A-L-E-B, last name Cage, C-A-G-E, here on behalf of Eureka County. Eureka County wishes to preserve its agricultural base as much as possible, but they are also realists in recognizing the solar energy transition. Eureka County has been interested in finding ways to incentivize agrivoltaics for some time. This is in recognition of the many solar projects currently being pursued on private agricultural lands in Eureka County. We currently have literally thousands of acres of private agricultural land under lease or some other type of site control for solar development in Eureka County. Some of these leases are on lands where irrigation water rights no longer exist. We believe integrating agriculture with solar developments is the best we can hope for on these lands. We believe integrated use of agriculture with solar and incentivizing these is good policy. AB 479, as amended in the first reprint, strikes the right balance in incentivizing agrivoltaics while not creating any additional tax revenue burdens on counties, and while actually enhancing tax revenue on lands already assessed as agricultural property. Thank you, and we urge you to continue moving AB 479 forward.
Thank you very much. Any additional callers, AVH?
Good evening, Chair Dondero Loop and members of Senate Finance Committee. This is Sheila Bray with the University of Nevada, Reno. We too are in full support of this bill, and we'd like to thank Assemblymember Watts for engaging us very early on in the interim to see if we might be able to share some of the current things that we may be doing in this space. Just as many of the other proponents have shared, and I really thank Senator Titus for her question as well, as I believe that is exactly what we're trying to also achieve within specifically the College of Agriculture, as well as within Extension. And we think this is a unique opportunity for us to continue exploring the possibilities for our agriculture future. Thank you.
Thank you very much. Any additional callers?
There are no further callers to testify in support at this time.
Thank you very much. We'll go to opposition here in Carson City, in Las Vegas, and on the phone lines, please. AVH, when you're ready.
If you would like to testify in opposition to AB 479, please press star 9 to take your place in the queue. There are no callers wishing to provide opposition testimony at this time.
Thank you very much. And we'll go to neutral here in Carson City, Las Vegas, and on the phone lines, please.
If you would like to provide neutral testimony for AB 479, please press star 9 to take your place in the queue. There are no callers wishing to provide neutral testimony at this time.
Thank you very much. And with that, would you like to give closing remarks? Okay, have a nice evening. Thank you. We'll close the hearing on Assembly Bill 479. And members, we are going to transfer into a work session, and we'll go through these quickly. So if you'll give us just 1 minute to regroup with Mr. Thorley and Ms. Crockett. Okay, we are ready. We've got a few that we're going to add. And so we're going to start out with Senate Bill 185. And so I'll turn it over to Mr. Mr. Kucera.
Thank you, Madam Chair. Good morning, evening, afternoon, day, whatever it might be. John Kucera, LCB Fiscal, for the record. Starting off with SB 185 was heard in this committee on the 16th. Senate Bill 185, the first revision, requires Medicaid to cover personal care services provided to a Medicaid participant who is less than 18 years of age and has been diagnosed with a disability or chronic illness which prevents that participant from performing activities of daily living. Sections 1 and 2 of this act become effective on passage approval for the purpose of docking regulations and other purposes on January 1, 2026. The fiscal impact provided by the Division of Healthcare Financing and Policy on the bill as introduced included an approximate $1.2 million general fund impact. The bill, as revised on reprint 1, included a significantly larger impact totaling approximately $24 million in general fund appropriations. However, during the testimony on the 16th, the sponsor of the bill, Senator Taylor, talked about a conceptual amendment which would adjust the fiscal impact, which will be discussed here shortly. There were several parties in support of the bill, none in opposition and none in neutral. The proposed amendment that was discussed on the May 16th hearing would lower the fiscal impact, and it would revert eligibility and service limitations to the original version of the bill. Additionally, the agency on the 28th, which by all counts was yesterday, proposed an amendment to adjust the implementation date to January 1st, 2027 from January 1st, 2026. In total, and considering both of these amendments, first the conceptual amendment that was posted on Nellis and the conceptual amendment provided by the agency adjusting the implementation date, the total fiscal impact in general fund appropriations would be $135,086 in fiscal year 26 and $414,251 in fiscal year 27, including approximately $922,000 in authorized federal funding. If the committee wishes to take action to include total general fund appropriations of $549,337 over the 25-25 biennium, adjust the implementation date to January 1, 2027, and to adopt the proposed conceptual amendment to adjust eligibility and service limitation provisions to align with the original version of the bill, the appropriate motion would be to amend and do pass as amended.
Thank you very much. And if there are no questions, I'll accept a motion.
I'd so move to amend and do pass.
Thank you very much. I'll take a second from Senator Scheibel. Any discussion on the motion? All those in favor say aye. Aye. All those opposed say nay. Motion carries, and I'll give the floor statement to Senator Tyler. I'm telling you.
Should we do it together? We'll do it together. We'll do it together.
Can we start over? I will give the floor statement to Senator Taylor. Thank you very much. And the next one, I'm going to ask Mr. Thorley to explain the process.
Thank you, Madam Chair. Wayne Thorley for the record, LCB Fiscal Analysis Division. The next bill for consideration is Senate Bill 207, which the committee previously took action on a few days ago after having further discussions with the bill sponsor and the Division of Healthcare Financing and Policy. The committee may wish to rescind its previous action on this bill in order to consider a different action, which will be explained here shortly. So if the committee wishes to rescind their prior action, a motion will need to be made to rescind the prior action on Senate Bill 207.
Thank you very much, and I'll accept a motion.
I'd so move to rescind the prior action of this committee on the Senate bill.
Thank you very much. And with that, I'll take a second from Senator Scheibel. Any discussion? All those in favor say aye. Aye. All those opposed say nay. Motion carries. Mr. Thorley. Back to Mr. Kucera. They're keeping me on my toes tonight.
Thank you, Madam Chair. John Kucera, LCB Fiscal for the record. SB 207, the first revision, as Mr. Thorley noted, was heard previously in this committee on the 26th and the 27th. As amended, this bill transfers authority to establish and administer a program of all-inclusive care for the elderly, commonly known as PACE, from the Aging and Disability Services Division. This bill is effective upon passage and approval and for all other purposes on January 1st, 2026. On the bill as introduced, the Division of Welfare and Supportive Services of the Department of Health and Human Services included a fiscal impact for various vendor supports to bring this up. To implement this program. In conversations with the Division of Welfare and Supportive Services just earlier today, Administrator Hobson confirmed that based on clarification regarding the anticipated scale of the program, that welfare would have no fiscal impact regardless of the implementation date of the bill. The Division of Healthcare Financing and Policy on initial versions of the bill included net costs of approximately $1.2 million in total over the biennium, including about $627,000 in general fund appropriations. Net ongoing costs would also be included. The update based on the first revision of the bill included an updated fiscal impact of total general fund appropriations of $293,055 in fiscal year 26 and $184,057 in fiscal year 27. This bill would also include $415,808 in authorized federal funds to implement the provision of the bill. Testimony was provided by Senator Taylor, along with testimony by the Division of Healthcare Financing and Policy. Support was provided by the Primary Care Association, an Advantage Plan provider, as well as an individual. There was no opposition or neutral testimony. If the committee wishes to incorporate general fund appropriations totaling $477,112 over the biennium, including associated authorized funding, to carry out the provisions of the bill, the appropriate motion would be to amend and do pass as amended.
Thank you very much. And with that, I'll accept a motion.
I'd so move to amend and do pass as amended.
Thank you very much. And a second from Senator Scheibel. Any discussion? All those in favor say aye. Aye. All those opposed say nay. Motion carries. And I will give the floor statement to Senator Taylor this time. Yeah, I'm absolutely. All right. The next one is Assembly Bill 6. And I believe Ms. Crockett is going to help us out with this one.
Thank you, Madam Chair. Kathy Crockett, LCB Fiscal. Assembly Bill 6 was heard in committee this morning. It creates the fetal alcohol spectrum disorder treatment assistance program within the Aging and Disability Services Division of the Department of Health and Human Services. The bill was presented by representatives of the division. Regarding fiscal impact, it was noted that the bill is permissive and the program is to be established to the extent that money is available, so no funding is required to implement the bill. There was one comment in support, no comments in opposition or neutral, and no amendments were presented or discussed. If the committee wishes to approve the bill, the appropriate motion would be to do pass.
Thank you very much, and I'll accept a motion.
So move to do pass.
Thank you very much. Second from Senator Scheibel. Any discussion? All those in favor say aye. Aye. All those opposed say nay. Motion carries, and I will take the floor statement, and we'll go on to Assembly Bill 376.
Thank you, Madam Chair. Wayne Thorley for the record, LCB Fiscal Analysis Division. Assembly Bill 376 was heard this morning in this committee, revises provisions relating to insurance. It was presented by Assemblymember O'Neill and Adam Plain with the Division of Insurance. The bill requires the Commissioner of Insurance to establish and administer the regulatory experimentation program for insurance product innovation, and sets forth requirements and operations for the program and does other things. There was testimony and support from the American Association of Property Casualty Insurers, Nevada Insurance Council, Nevada Policy Research Institute, and the Americans for Prosperity of Nevada. There was opposition and support from four individuals testimony in opposition from 4 individuals, although many of them said with the conceptual amendment, which was received late in the committee hearing, that they would change their testimony to support. Neutral testimony was from CAI and the Nevada Justice Association. There was an amendment presented at the end of the bill hearing that you all should have received. I won't go over that in detail unless there are any questions. The Division of Insurance testified at the bill hearing this morning that with the amendment that's already been adopted on the bill, that removed the fiscal impact, and that the conceptual amendment that was presented at the bill hearing this morning had no change on that, so there's no fiscal impact to the bill. If the committee wishes to move this bill with the conceptual amendment presented this morning, the appropriate action would be to amend and do pass as amended.
Thank you very much, and I'll accept a motion.
So move to amend and do pass as amended.
Thank you very much. With a second from Senator Scheibel. Any discussion on this bill? All right, all those in favor say aye. Aye. All those opposed say nay. Motion carries, and I will give the floor statement to Senator Titus. And we'll go to Assembly Bill 503. And Ms. Crockett.
Thank you, Madam Chair. Kathy Crockett, Fiscal Analysis Division. Assembly Bill 503 was heard this morning. It establishes penalties for willfully removing, damaging, or destroying certain critical electrical infrastructure to obtain used utility wire. The bill was presented by Assemblymember Torres Fawcett. Regarding the fiscal impact, it was noted that a fiscal impact of the Department of Corrections was removed with a prior amendment. There were no additional fiscal impacts noted for the state. There were 3 comments in support, no comments in opposition or neutral, and no amendments were presented. If the committee wishes to approve the bill, the motion would be to do pass.
Thank you very much, and I'll accept a motion.
I'd so move to do pass.
Thank you very much, and a second from Senator Scheibel. Any discussion? All those in favor say aye. Aye. All those opposed say nay. Motion carries, and I will give the floor statement to Senator Wynn. And we will go on to Assembly Bill 570. Mr. Thorley.
Thank you, Madam Chair. Wayne Thorley for the record, LCB Fiscal Analysis Division. Assembly Bill 570 was heard this morning in committee. It makes appropriations to the Department of Corrections for various purposes relating to certain technology, training, and equipment. The bill was presented by Director Zarenda with the Department of Corrections. There was no testimony in support, opposition, or neutral. The various dollar amount of the appropriations and their purposes are listed in the various sections of the bill. There were no amendments presented. However, fiscal staff has a recommended amendment related to the language in Section 5 of the bill. This bill was amended in the Assembly to reduce the dollar amount in Section 5, essentially to eliminate funding in Section 5 for a garbage truck, a dump truck, and 2 of the refrigerated trucks. However, language in Section 5 still exists related to a garbage truck and a dump truck. If the committee wishes to move this bill, fiscal staff recommends an amendment in Section 5 to remove the reference to a garbage truck and a dump truck, and so that just a reference to a refrigerator truck would remain. If the committee wishes to move this bill with that amendment, the appropriate action would be to amend and do pass as amended.
Thank you very much. I'll accept a motion.
I'd so move to amend and do pass as amended.
Thank you very much, and I'll take a second from Senator Scheibel. Any discussion on this? All right, seeing none, all those in favor say aye. Aye. All those opposed say nay. Motion carries, and I think it's only fitting that we give Senator Scheibel a bill with vehicles and refrigerator trucks. All righty, Ms. Crockett, Assembly Bill 572.
Thank you, Madam Chair. Kathy Crockett. Assembly Bill 572 was heard in committee this morning. It makes general fund appropriations totaling approximately $333,000 over the biennium to the Department of Corrections for equipment purchases and furniture replacement at various conservation camps throughout the state. The bill was presented by the director of the department. There were no comments in support, opposition, or neutral, and no amendments were presented. If the committee wishes to approve the bill, the appropriate motion would be to do pass.
Thank you very much, and I'll accept a motion.
I would so move to do pass.
Thank you very much. Second by Senator Scheibel. All those in favor say aye. Any discussion? All those in favor say aye. Aye. All those opposed say nay. Motion carries, and I'll give the floor statement to Senator Stone. And I will go to Mr. Thorley, Assembly Bill 574.
Thank you, Madam Chair. Wayne Thorley again for the record, LCB Fiscal Analysis Division. Assembly Bill 574 was heard this morning in committee. It makes an appropriation to the Department of Corrections for the purchase and replacement of equipment and furniture at High Desert State Prison. The various appropriation amounts and the purposes of those appropriations are listed in the various sections of the bill, which I will not go over unless there are any questions. The bill was presented by Director Zarenda with the Department of Corrections. There was no testimony in support, opposition, or neutral, no amendments presented or discussed. If the committee wishes to move this bill, the appropriate action would be do pass.
Thank you very much. I'll accept a motion.
So move to do pass.
Thank you very much. Senator Wynn, second from Senator Scheibel. Any discussion? All those in favor say aye. Aye. All those opposed? Motion carries, and I'll give Senator Neal the floor statement, please. We will go to Ms. Crockett for Assembly Bill 576.
Thank you, Madam Chair. Kathy Crockett. Assembly Bill 576 was heard this morning. It appropriates $18.9 million of highway fund to the Department of Public Safety, Nevada Highway Patrol Division for various equipment purchases and replacement of motorcycles and vehicles. The bill was presented by representatives of the Highway Patrol. There were no comments in support, opposition, or neutral, and no amendments were discussed. If the committee wishes to move the bill, the appropriate motion would be to do pass.
I'll accept a motion.
So move to do pass.
Thank you very much. Second from Senator Scheibel. Any discussion on this motion? All those in favor say aye. Aye. All those opposed, nay. Sorry, say nay. We're getting tired. Any discussion? All right, with that, motion passes, and this is way too much fun, so I will give the floor statement for motorcycles and vehicles to Senator Scheibel. All right. We will go to Ms. Crockett again for Assembly Bill 593.
Thank you, Madam Chair. Kathy Crockett. Assembly Bill 593 was heard this morning. It appropriates general funds of $53.4 million and highway funds of $12.5 million to the Interim Finance Committee contingency account for allocation to the Governor's Office of Finance for costs associated with implementing the Enterprise Resource Planning System project known as Core NV. The bill was presented by the Governor's Finance Office. There were no comments in support, opposition, or neutral, and no amendments were presented. If the committee wishes to approve the bill, the appropriate motion would be to do pass.
Thank you very much. And with that, I'll accept a motion.
So move to do pass.
Thank you very much. I'll accept that from Senator Wynn. Senator Scheibel, second. Any discussion? All those in favor say aye. Aye. All those opposed? Thank you very much. Motion passes, and I will give the floor statement to Senator Buck. All right, that completes our, oh, we have one more, I'm sorry. We have, I'll go back to Mr. Thorley, and we have Senate Bill 507.
Thank you, Madam Chair. Wayne Thorley for the record. LCB Fiscal Analysis Division. Senate Bill 507 was heard this morning in committee and presented by fiscal staff. The bill revises provisions relating to the Office of Nevada Boards, Commissions, and Council standards of the Department of Business and Industry. This is a budget implementation bill. It implements the closing budget actions of the money committees when closing the budgets for the Department of Business and Industry. In particular, this bill would authorize the Office of Nevada Boards, Commissions, and Council standards to assess a fee to the various occupational licensing boards in order to fund the operations of the office. The bill also would move the Commission on Post-Secondary Education back to the Department of Employment Training and Rehabilitation. There is no testimony in support, opposition, or neutral. There are no amendments. If the committee wishes to move this bill, the appropriate action would be to do pass.
Thank you very much, and I'll accept a motion.
Do pass.
Thank you very much, Senator Wind. Second from Senator Scheibel. Any discussion? All those in favor say aye. Aye. All those opposed, motion passes, and I will give the floor statement to Senator Wind. All right, with that, now we are finished. And with that, I believe, committee, we will definitely be meeting tomorrow morning. I believe we will probably be doing 8:30. Stay tuned. We'll check in the morning. We've got a little bit of, staff has some work to do, and we've got to get some things going. So let's head for 8:30, and we'll let you know if it's anything different. All right? All right, with that, public comment. Is there anyone here in Carson City, in Las Vegas, on the phone lines, AVH, if you're ready?
If you would like to provide public comment today, please press star 9 to take your place in the queue. There are no callers wishing to provide public comment at this time.
Thank you very much. And with that, this meeting is adjourned.